What's up, fellas? Sorry I'm late tonight. I just had some other stuff going on. Anyhow, uh yeah, I don't have like a big a bunch of stuff ready this evening. Usually I have something more substantial, but this one I just been thinking about this for a little while, for the last couple hours. This Lindsay Clancy business here with this woman that strangled her three children with an exercise band. I mean, it's disturbing. It's that like that we've seen before though. Like that's actually not really, it's disturbing and it's not something you like to see, but like I said, we've seen it before. What we haven't seen before is literally all the women of America coming out and defending her, or I don't even know what how you would put it, but women coming out and accusing the guy or just outright saying that she didn't do it. And like a lot of these women are like going off of tarot, astrology. It's sickening. And it's like you realize why witches were taken so seriously in the past and why this stuff, I feel like this stuff was kind of I mean, taken like witches were taken seriously, but I feel like Western society used to really discourage this kind of stuff. Like the dark art, like the dark black magic types, not really black magic, but this pseudo spiritualism that particularly women really dig. I mean, it's like their thing. Uh, and they never miss a chance to talk about it. Anyhow, play this real quick.
Clancy, what a weird, dark story, folks. If you're not into it, you're not going to like this. But if you're into these murdery, mystery, all this stuff, this is just the
Uh,
one of the weirdest stories I've ever heard in my life. Literally, it's one of the weirdest stories I've heard in my life. Lindsay Clancy's phone was used to search, "Can you treat a sociopath?" On January 20, 2023, days before she killed her three children, a state police investigator testified at a trial Thursday. Jurors heard from Massachusetts State Police investigators Timothy and Sergeant Kyle Pavot on the forensic analysis of Clancy's phone and her ex-husband's Patrick Clancy's tablet. Clancy has pleaded not guilty to three murder charges and the death of 5-year-old Cora, 3-year-old Dawson, and infant Kaylin at the family's home in Duxbury.
and really, what I don't really want to talk about this woman strangling her children, but what I do want to talk about is the response that has come out of out of our society. How these women desperately want this woman to be the victim. I heard somebody say the prosecution, the defense, or the prosecution says she did it. The defense says she did it. Her husband says she did it. The woman herself says she did it. Yet if you look on the internet, it's like to a woman, they don't believe that it's the man who did it. It's the man. He did it. Somehow he did it. And it's is this just the beginning here that like, are we only seeing, because I feel like something has, like, this is going to be more the way our society is more going forward. you know, and I mean, the way I see it is it's like all of a sudden, because women want to say, I'm trying to say it like that, but it's women are very politically active, and they're very confident politically. They're politically confident. And so anytime an issue comes up in politics or issue comes up in our society, they're like dead set, or they're sure they're right, and they have been sort of pampered in that way, coddled and told how special and how right they always are. So when there are these really toxic circumstances, or really toxic uh, reaction, or just a toxic reaction to things, political, whatever, stuff in society, and there's no way to talk them down from the edge. I mean, there's no way to talk them down from the edge. They won't hear reason. If you try to reason, and what's the worst part about it is that they all think in one with one mind. It's like uh it's crazy. They all sort of stick together. I mean, and this is the way women are. They stick together with their group, and therein lies the problem. You know, this portends really poorly for us, man. It's like, picture the future where they're convinced political policy is right and the best for everybody, and they just overrule everybody else, and take us down a course that doesn't end well, and they can't be talked down from the ledge. Like, it's quite disturbing, and there's nobody, they won't listen to a reason. There's no institution that they'll actually listen to. The only institution that they care to hear from is their own, is like the Longhouse. Yeah, it doesn't portend well.
On January 24, 2023, defense lawyers don't contest she was responsible. They argue she shouldn't be held criminally responsible because she was suffering from postpartum psychosis. Are you kidding me? I'm struggling so hard because I wanted to parent each of my kids like my first, and since I can't, that's depressing to me. Clancy wrote an October 2022 phone note. Per prosecutors, this is definitely the root cause of all our problems. She appeared frustrated with compromises around newborn Callan. I hate that he has to put himself to sleep. I'm sad I'm not breastfeeding anymore. Prosecutors are using their searches and notes to argue the killing were premeditated. The defense says they show a mind unraveling, that a show mind is unraveling. Vinny, do you have a clip on this?
I'm sending Connor right now. Connor, there's a clip of her in the courtroom. I think
disoriented shortly after, and then even go back to acting like their normal self.
How convenient. It is the most convenient.
Yeah, that's essentially what's going, like, that's the way it seems here. There's this woman kills her kids. Everybody involved agrees she killed her kids. Every woman in America disagrees. I think I think they feel like they're being attacked, is what's going on here. And like, man, I honestly, man, I'm kind of reticent to even talk about this, even just because multiple reasons, because I'll get worked into a lather. Who knows what, like, but are they adults? Are they are women capable of uh responsibility? Are they, are they actually adults, or can they not be held responsible for their actions? Like, which is it? Are you capable, responsible adults that can, you know, uh, strong and independent, or when you kill your kids, is it not your fault? I mean, they're mutually exclusive. Yeah, and it seems kind of crazy too. Why would women be defending this? Like, I don't get why they would defend it. It's like, are they afraid that they're gonna do this? Like, is that what's going on here? They're like trying to kind of get a precedent set, so just in case, like, no, man, it's no matter what, things are gonna get worse after this. No matter what we say isn't gonna matter after this, or what we say about this isn't gonna matter. Anyway.
Psychiatric diagnosis ever. And it only happens to women. It's only the postpartum psychosis we're talking about here, not the schizophrenic psychosis, not the drug induced psychosis. It's only the psychosis that can only happen in women. How convenient. It is so far from reality. Within 48 hours, there was a strange phenomenon that took place on the internet, on social media, on parenting forums, across anti-psychiatry messaging boards, that she was no longer just a criminal defendant. She became something of a martyr almost overnight.
The difference between my husband and Lindsay Clancy's husband, my husband, when I was going through the throes of my postpartum, made sure that I didn't feel obligated to fulfill that mother role and focus on healing myself.
Hashtag I stand with Lindsay Clancy. The system broke her. The meds did this. They're trying to make her into a sympathetic poster child for a bad healthcare system, victim of a maternal burnout. Look how dangerous it is to become a mother, or look how dangerous psychiatric medications are in general. And I think what we're seeing here is yet another case where we are changing definitions to avoid confronting what women are capable of. Because if Lindsay Clancy is purely a victim, then the world remains a place where women are purely a force of moral superiority,
And they're always victims. That's what this is about. They can't allow this. They can't allow this woman to go down without defending her, at least, because it will affect their victimhood. They won't be able to claim pure victimhood. Huh. It's not off.
good, and real victims are cold and faceless men.
What are
We
you
don't have to
talking about? It's all on.
confront the alternative, which is that an educated middle class labor and delivery nurse could harbor some
nurse.
real resentment.
A nurse, too, nonetheless.
And crave an escape from her life and make a deliberate conscious choice to destroy her own children. And now I'm recording this. The trial is still ongoing, although
What's kind of crazy is uh nothing was stopping her from walking away. What excuse does she have? She could have gotten a divorce and just left. No fault divorces. Like, we have all these laws so that women won't feel like they have to stay. I mean, straight up. That's the whole point of these things. And they, these laws, they do quite, I mean, they're not harmless. Like, they've done damage to our society. But apparently, for not. Like, they're still going to claim it's like what no fault divorce was put in place to ameliorate. They're still, it doesn't matter if no fault divorce is in or not. They're still going to claim the same thing. So it's like, yeah, we we did the no fault. I mean, well, like, maybe it's benefited them in other ways. I don't know. I don't really pay all that much laws, but you can bet our society is just going to take another massive body blow, that it will never recover from.
The facts have been delivered. What remains now are sort of expert testimonies on diagnoses in general. And what I want to talk about is the psychiatric language around this case, what the narrative pushes, and where I think people are wrong when they're talking about the psychiatric medications in this case. So the prosecutors are trying to show that this was a planned action. And they are showing that in the afternoon of January 24th, Clancy did not exhibit the chaotic, unraveled behavior typical of an acute psychotic break. Earlier that day, they're showing that she took her daughter to a pediatrician's appointment. She built a snowman in the yard with the children, and she sent photos to family members. And then she opened Google Maps on her phone. She searched the exact driving distance and transit time from her home to the restaurant in Plymouth.
And if a man killed his wife or killed his 3 kids and his wife, nobody would have any difficulty believing that. Nobody would give that guy the benefit of the doubt. They would automatically assume that the guy was a wife beater, he was a violent guy, and that men are capable of this. But a woman does it. And people automatically assume that she must have had a psychological break. Something must have snapped inside of her to do this. Like I said, with a man, if a man had done this, people would say, oh, he was just a psychopath all along. He'd been hiding it. Whereas people that, the idea or the idea that she was a psychopath for her whole life, people aren't even acknowledge that isn't even a possibility in people's minds. Isn't even a possibility. Everybody automatically sort of is giving this woman the benefit of the doubt. And the prosecution, rightfully so, are like, we think that she planned it. We think that, we're not buying that stuff. Why should we buy that stuff? People don't have to have a psychological break to commit murder. They do it all the time. Like, I don't know why. Like, it's ridiculous that any human being should get that benefit of the doubt. Like, what? And one thing I couldn't help but note, or I remember when I was growing up, I got a little brother as well as a big brother, but as they say, shit rolls downhill. And I remember, if my older brother picked on me, and really I didn't pick on my little brother, almost at all. He was sick when he was an infant, so my parents were like, whoa, overly protective. Like, I wasn't even allowed to touch him for a couple years. But I remember the few times that I did, I remember, seeing him later on taking it out on pets and stuff. Like, he would take that sort of frustration out on the dog, the dog was twice his size at the time. So it's like, really not a big deal. But Probably could have eaten him for all we know, but and it's like human beings, they can be pretty rough on their subordinates. They can be pretty rough on their inferiors, and it's like there's it's not a coincidence that when women commit murder, quite often it's on little children. Quite often it's their own children. Quite often, or almost usually, it's towards children or somebody, you know, they can handle, I guess you would say. I don't, but I mean, it just seems kind of ridiculous to give anybody the benefit of the doubt. If somebody kills 3 kids like that and like really cold blooded that way, I don't think anybody should give them any benefit of any doubt. Women raise children every day without strangling them to death. They do. Like, man, I just see this is a really bad road we're on right now. I mean, truly, this is a really, really bad road we're on. And I think we're just we're this is just the beginning. I think this is just the beginning.
3V and a nearby CVS pharmacy. And once she'd calculated the timing, she asked her husband Patrick to leave the house to pick up takeout dinner and Pedialyte. The prosecutor's argument is pretty straightforward. This was an engineered isolation window, a deliberate 25 to 30-minute gap where she ensured no one would be able to interrupt her and what she planned to do in the basement. She then took the kids one by one down into the basement and strangled each of them with an exercise band. When her husband called her from the CVS pharmacy to ensure that he was getting the right medication, she answered normally. Her tone was composed and lucid. And minutes later, she carried out the killings sequentially. And it was a continuous physical exertion of 7 minutes per child. Now, the defense claims that she was
Dude,
suffering
that's
from
so fucking
postpartum
chilling.
psychosis, possibly.
That is so chilling, bro. That literally made me nauseous when she said that. Bro, that is so blood curdling. To say that that's disturbing is like an understatement, but 7 minutes physical exertion, bro, it forces me to picture innocent kid, because animals, whether they're awake, whether they're conscious, when they're dying, or if they're when they're dying and like being asphyxiated or uh asphyxiated either by cutting off the blood or by suffocating, they struggle like all hell. Even people when they overdose, because that's asphyxiation, essentially you're dying of asphyxiation, you don't just lay there still, you like thrash about a little bit. Man, that is some cold-blooded shit right there. Couldn't imagine being that husband. I could not imagine. And then, no matter what, because the guy's he's gonna get a lot of the blame for this. No matter what happens, there's gonna be a lot of people out there that will mumble that in under their breath the rest of their lives. Like, no matter what happened, women are going to what they're going to believe is that he is responsible in some form or fashion. Somehow. Apparently he was cheating on her or something like that. You can already see they're starting to, oh, she knew, she knew, she knew. That's why she did this, which is not a justification, but people are going to work overtime to make excuses and to, get try and help this woman dodge accountability.
In the context of an underlying undiscovered bipolar disorder, and that months of rapidly changing psychiatric medications destabilized her. And her attorney says, and she claimed herself after the killings, that she heard a male voice, a commanding auditory hallucination, saying to her, "This is your last chance. Kill the children so you can kill yourself." Now, this is a psychiatric explanation, and a psychiatric explanation is not the same thing as a legal excuse. You can be mentally ill and criminally responsible. Prisons are full of diagnosable sociopaths, both male and female, and Massachusetts law is pretty clear about this. The question is not, did she have a diagnosis? The question is whether that mental disease made her.
This woman is also she's a like a legit psychiatrist. Like she's real deal doctor. So like, and this is her forte, women specifically. Um, so she actually knows what the hell she's talking about right here. I think, and honestly, above most, I wouldn't trust just watching any psychologist or psychiatrist. There's a lot of wackadoos out there, but I've been watching her for, probably been a couple years now. And, she's pretty objective. If she's not going to run cover, actually what her channel is about is more like, sort of, helping people understand the, pathologies of women.
Substantially incapable of realizing any wrongfulness of her actions in that moment. And once lack of criminal responsibility is raised, then it's on the Commonwealth to prove that she was, in fact, criminally responsible beyond a reasonable doubt. Now, let's first talk about psychosis. I think this is what is being properly bent out of shape, especially when we're talking about mothers and women. Postpartum psychosis, it's real and very rare. It is a psychiatric emergency. It is very dangerous for the child. Women can become manic, delusional, disorganized, and hallucinate after childbirth, especially if they have a pre-existing psychiatric history. But it has a characteristic timing. It usually occurs up to 3 weeks after childbirth, within those first 3 weeks, because it's strongly associated with the hormonal shift and the lack of sleep. Definitionally, a psychotic break is when you lose touch with reality. You lose yourself in that moment. It's severely debilitating. And I wanted to quickly show you what it looks like, because I don't think people are really aware what a psychotic break really looks like. So then we are easily fooled to think, well, it can have all these different types of manifestations, and it can look like this in some people, and it can look like that in other people.
I can't describe an illustration.
Does it feel to you any different from the way other people stand?
Yes, it feels different.
In what way?
Now, look at his eye movements. He seems to not be perceiving the conversation in the way that a normal person would perceive a
Creepy as
conversation.
all get out. That's
This is becoming too involved to describe.
He is not focused. He's disorganized. His thoughts are disorganized. He's taking a long time to answer because he's like maybe having conversation with several people in the room at once. It's really best described like this. Imagine you're in an event hall, you're at a huge party, it's 100 people, and the music is blaring from the stage. You're in the middle of the room, you're meeting a friend, you're both drinking, it's really loud. And then, let's say you haven't met that friend for a while, and then that friend wants to then talk about deep feelings and how you have been, how have you really been this past month where we haven't seen each other. And you're standing there and you're really distracted and there are so many people around, and actually you're just looking at the door because you want to see if that guy that you have a crush on is going to come. So you're really monitoring the door. At the same time you're thinking, oh, am I looking good? Is my hair okay? What am I wearing? How are people looking at me? So your eyes are sort of twitching back and forth. And then your friend, she's annoyed because she wants to have a conversation, so she keeps screaming this question at you again and again. How are you feeling? And you're just like, oh, what are you asking? Not really hearing the question. And then you answer something, but it's not really an answer to the question. So she repeats the question even louder. And so that's what it's like to have a conversation with a psychotic person. It's like you're not really having the same conversation and you're not really in the room alone with that person. And you can see that in this video. Here's another video of someone who's psychotic. Do you see the expression is very tense, firm, it's different. You can just tell something is off. These two were actually quite lucid. You look at them, you think, is that someone who could execute an organized murder in 20 minutes and create that sort of a gap? So that's what the prosecutors are trying to hone in on. They're trying to collect
And this is the thing with all, first of all, what is pathologizing of everything where everybody's got a mental illness, whether they do or not, but everybody claims to have one, and any mental illness can make it totally acceptable for any behavior and this and that. It's like, no, people, and the problem with it is that you get situations like this and nobody's just guilty anymore. Everybody has some garbage excuse. It used to be back in the day, if you killed somebody and you were guilty. Figures.
Evidence that Clancy was oriented and organized in her behavior the day of, the day before, and the day after the murder. And so far, none of the people who have testified have given any sign that she was neither disoriented or disorganized, coming across any other way than she had been for months before. She was depressed, she was exhausted, she was anxious, and that's the symptomatology that keeps being repeated. None of the psychotic symptoms that you would expect to see. At the very minimum, you would expect to hear something about confusion or preoccupation with certain ideas or a fixation. That is also what happens. They get very fixated on their delusional beliefs, their ideas. And that's then usually what they're thinking about when you're trying to have a normal conversation with them. And this is where I'd like to draw the parallel between two cases that are coming up now as this case is getting a lot of attention. So they're talking about other postpartum psychosis cases like Andrea Yates. That was in 2001. That was a sort of classical altruistic filicide via psychotic depression. And Yates, she drowned her 5 children in a bathtub in Texas after her husband left work. So she also created this sort of gap, but she had severe, indisputable, documented psychotic prodromes before the crime. So she had catatonia, she had standing in stupors, she had explicit delusional beliefs about Satan.
See, that right there, it's safe to assume that that woman had some real mental issues. Andrea Yates, safe to assume. This other woman, Clancy, I'm not so sure. It looks like she has any problems. Although, all the medication they give out nowadays, but it's like, I don't buy that though. At the same time, it's like, if you start having bad thoughts or something or like that, and you're a mother, you should say something. You should recuse yourself from this situation. You know what I mean? Like, obviously, if whenever like I had problems with controlling my impulses in the past, well, I had to account for that and just make sure that I wasn't put into a position that could be compromising for me. Like that was my responsibility. If I had, you know, gotten into a situation that I was compromised, it's not an excuse to say, well, it was because this guy, walked across my path and I just blah, blah. No, that's not how it works. And I feel like, well, I was saying before how, they're just trying to find excuses for this woman for why she shouldn't be held accountable. And no, that's garbage. Like, no, she should be held accountable. Unless it was like that Andrea Yates woman where it's obvious, hey, this person had some issues before. And with her, it's maybe her husband failed her, maybe the system failed her, who knows? But either way, somebody else bears some responsibility in that Andrea Yates one because she was known to have those issues. This woman, it just seems rather convenient to me. Like she's saying, that's mighty convenient, the way all this, it tends to always be so convenient for women. There's always
or documented. They're finding from Lindsay Clancy's journal, she wrote journals, is that she was chronically anxious, perfectionistic, exhausted, nothing about overt delusional content, nothing. And so Andrea Yates, she was ultimately found not guilty by reason of insanity, which is what they're going for in the Lindsay Clancy case. And the same goes for the Dana Schlosser case in 2004. That was acutely psychotic. She had a command hallucination. She severed the arm of her 11-month-old daughter while listening to religious music in a state of
my
acute
God.
postpartum psychosis. When they
Holy
look at the crime scene, it was extremely chaotic and violent and disorganized. When the police arrived, she was calmly sitting covered in blood, holding a knife and humming hymns. Clancy's physical execution, it was, as I said, organized. It was quiet. It was followed by an immediate suicide attempt, jumping from a window. Although I think you can make an argument, and they are trying to make that argument, that it wasn't a proper suicide attempt. It wasn't very high, and the ER doctor testified to the cuts on her wrist being very shallow. Schlosser's psychosis, it was glaringly obvious to those around her prior to the act. Lindsay Clancy, she maintained normal, composed interactions with a pediatrician who knew her. She took her daughter to their pediatrician, and the pediatrician just testified in the trial saying she saw nothing out of the ordinary. She had a phone contact and contact with her husband right up until the hour of the event, where nothing out of the ordinary was noticed. And so that's why I thought it's important to show you these videos of these psychotic people where you think you would at least have someone who knew her say something was off, because it is so apparent. It's such a severe psychiatric
basically,
incident, a psychosis.
it's like people, these people, they do this and they want a way. They're trying to find a way to do this to their children or to somebody and get away with it with an insanity plea. So they they go through these steps, but it doesn't fit. Like she said, there isn't the typical erratic, all over the place that isn't here. It's all organized and like very just not erratic, not chaotic, and shallow cut shallow on her wrist. She jumps from a. That is, she didn't half-ass strangling her little children, did she? Notice that. She made damn sure that she did the job when it came to those 3 kids. But when it was her turn, Butterfingers, like she's just a clumsy woman. Like, isn't it? Doesn't that seem a little odd? Like, man, she went about the work of taking her kids out like a like a machine, man, like a machine, and then half-assed her suicide attempt, bro. I'm not buying that, man. I think, and you know what? Even if she is, just crazy. Well, I think, I'm thinking maybe she should get this. She should get the chair or the noose, all the same. Honestly, she could have said something. I mean, and as a society, we cannot just be expected to allow people to murder their whole family and just walk away, no problem. Like, and I mean, it just, even if the person is crazy, they should at least go to prison for the rest of their life. Because it's just, it's so downright, it's like demonic, it's kind of a trite word to say, but it's just, it's a whole nother level of evil. I mean, that kind of evil, like, I don't even ever want to be in the presence of that kind of evil. That's a darkness that I don't want to be near that stuff. It sucks enough to have to hear about it.
So, one obvious problem here for the defense is the absence of any markers suggesting a psychosis. And the other is that the American Council for Obstetric and Gynecology, they describe the onset of postpartum psychosis at usually between 24 hours and 3 weeks after delivery. And Callan was 8 months old when he was killed. And that doesn't mean it can't happen, but it means that there's a weakness in that argument apart from the absence of the symptomatology before and after. Defense's case, they're then combining 2 distinct phenomena to sort of bridge these vulnerabilities. So the other claim that they're making is that this is a medication-induced mania, and that places the blame on the treatment team and the prescription drugs. It's a hard sell, but adding the postpartum psychosis then reestablishes this organic, involuntary medical emergency. And so by weaving these 2 together, they're presenting a sort of hybrid narrative that she had an underlying bipolar spectrum vulnerability, and her postpartum state created a neurobiological fragility, and that the aggressive medication changes that she had in the last 4 months that acted as a catalyst that then triggered command hallucinations. So that's the entirety of this claim. And so then let's quickly talk about the second phenomenon that they're claiming, that the medically induced destabilization happened because she had an underlying undiscovered bipolar vulnerability. Now, let's quickly talk about her psychiatric history. So she had her 3rd child in May of 2022, and after that,
It's like, what this woman could have tapped out. She could have just said, "Hey, this is too much pressure for me. This is too much for me. I want a divorce, or I don't want the kids, and I don't want to be with you anymore." Always has that opportunity. I really don't think there's a leg to stand on where that's concerned anymore. It's like, convince me why. I want to hear a good argument for why this woman doesn't deserve to answer for her behavior, her actions. Why should she be exempted from accountability or responsibility when she could have said something at any time, at any time. It's like, what do we have no fault divorce laws for? What do we have this huge garbage medical system? What do we have? I mean, it's not, I'm just saying it's garbage in my opinion, but what do we have all this stuff for? What do we send people to college to study psychology and psychiatry and medicine for if people are just going to, have thoughts of murdering their children and just, kind of take it in stride? She's already going to the doctor for whatever, depression or anxiety or whatever. Well, she didn't think to mention her suicidal and murderous thoughts to her doctors. She made sure to bring up her anxiety. She made sure to bring up whatever it is that she claims to be suffering from to get pills. But she can't bring up the fact that she's having crazy thoughts. Like, I'm just tired of this, man. I'm tired of this, bro. Do we just not live in a society that holds people accountable anymore?
Reported brain fog and anxiety and insomnia, and that's when they engaged an outpatient psychiatric clinic. She was briefly admitted for an in-hospital stay at McLean Hospital anxiety and depression treatment program. That was early January 2023. She was evaluated. She was cleared of any suicidal or homicidal ideation and discharged. Before the third birth, she hadn't had any psychiatric care. And what the defense is focusing on is that in those 4 months, she went through 13 different medications. This is where her treating psychiatrist testified on stand.
She was on amitriptyline, diazepam. I believe she was also on prescribed lorazepam. And there may have been one other.
Are you as a psychiatrist aware that Zoloft and or SSRI Prozac should not be prescribed to a patient who has bipolar?
Yeah, it can be prescribed. Oftentimes it's prescribed together with another medication that can be protective because patients with bipolar disorder may be experiencing depression. And so they may be prescribed an antidepressant, but along with another medication that what we call protective.
What they're alluding to here is that she might have what they call switched. That is when a person is usually a bipolar 1 patient when they're on an SSRI, so an antidepressant, and only an antidepressant, that can cause a manic episode. And so what you usually want that patient to be on a mood stabilizer, which is Seroquel, for example, which is also what Clancy was prescribed, in addition to the antidepressant to sort of prevent the mania from occurring. But my problem with I've seen such a switch several times. It doesn't happen overnight. It takes a little while, and it's usually noticeable. She had a lot of psychiatric care, and you're not allowed to prescribe an SSRI without doing an assessment, without making sure that the patient isn't bipolar, because such a switch is so well known that it is very unlikely that such an assessment wasn't done because she did have a lot of care. She was hospitalized. So until now, no one had suspected that she was actually bipolar. The other thing is she's 35 years old. A bipolar usually manifests between 15 years of age and 24. So that also wouldn't be typical.
You knew, as a psychiatrist, at least looking at her history, you knew that she had been seeing psychiatrists immediately prior.
Women are defensive about this, and rightfully so. Rightfully so, man. Because I'm thinking about it. I mean, literally, as that woman was talking right there, I'm thinking to myself, like, man, if this just doesn't crystallize some of my thoughts and feelings towards women or getting married and stuff. I mean, I get why they're all bent out of shape about it and why they're up in arms. This doesn't look good for them. You know, this looks really, really bad for them. They think it's hard for them to find a boyfriend now. Just saying. Just saying. This is just one more tally against, you know, and then their response too, their sort of knee reflex, or what they call it, but sort of the knee kick reflex to jump in and make excuses for this woman. And this is just another. And I agree with you there, cowboy. I mean, honestly, regardless, I think, yeah, she should definitely be convicted, or she should have to answer for this, certainly. And it doesn't really seem like she has all that. It doesn't really feel like she's got anything any real excuse here, like this insanity plea. It's kind of it's coming off as bogus. Like, yeah, I don't buy it. Like I said, the way she went about those kids like a machine, but when it was time for her to you know, take care of herself, she just, you know, totally muffs it. She just flubs the damn thing. Come on. I mean, it's crazy.
Her suicide attempt, correct?
Correct.
And Ambien, correct?
Correct.
And
what in the hell is wrong with people? Like, why are they why are we doing this? Why are we doing this in our society? Why are we just, you know, just give everybody is medicated? When everybody's medicated, well, then everybody has a reason for being, you know what I mean? Like and not only that, yeah, they have a reason that they can, an excuse, but at the same time, like, we don't know, like, we know how human beings act when they're sober. We know typical behavior and stuff. But when you throw these medications in, and now, you know, maybe only the psychiatrists even have an idea of how she should be acting. The rest, I don't know how somebody should be acting with those medications. With, like, bro, I couldn't even pronounce half of them. You know, so it's like, who knows how she was supposed to be acting and stuff. But like, you get into these weeds with all this medication, it's like, we don't know where we're at. We don't know. We don't have a frame of reference. There's no standard that these people can be, that anybody on medications can be pegged to.
Zolpidem.
Yep, Zolpidem is the generic name of Ambien.
Oh, okay. All of these drugs that we just went through were all prescribed from end of September till January.
Yes, September 2022.
4-month period.
Yes.
It's an awful lot of drugs to be prescribed in 4 months, isn't it?
Sustained. So I can completely understand why the defense asks, this is an awful lot of drugs to be prescribed in 4 months.
Sounds like
And that
it.
is what the anti-psychiatry movement will look at this case and see, look how awful psychiatric medications are. And I'm extremely critical to psychiatric medication. There's a huge conversation we have to raise here. This is not good practice, but it is standard. This is not uncommon, very sadly. A lot of patients are on this sort of constellation of medication with Zoloft or Prozac, with Remeron in the evening.
It kind of makes one wonder if the rise in suicides is because of the medications, not because the people are crazier. You know what I mean? Like, I would imagine, like, from what I understand, suicide rates are the highest they've ever been. And it's like, well, why is that? Why is it that when people had no medical, they had no medication, they had no way to ameliorate mental problems, you know, other than from insane asylums? Why is it that then it was, the suicide rate was lower. When they had no help, the suicide rate goes up the more you help them. That doesn't seem right to me. I mean, maybe it's the medications. Maybe it's not mental illnesses that are causing this. You know, I mean, there's something to be said for institutions. People just being institutionalized. I mean, if the alternative is fitness bands around kids' necks,
or trazodone, I don't think it's in any way defensible to prescribe Seroquel or Lamictal or Klonopin to a depressed patient, although it's seen as the gold standard in treatment-resistant depressions. But it causes severe sedation. For someone who has trouble with exhaustion and anxiety, to prescribe something that'll make them so sleepy, it doesn't make sense. I have never seen an improvement when you add these drugs to a depressed patient. It is a lot. It is sadly not infrequent. It is sort of standard of care, it seems. And I've seen this.
And I bet you I'd be willing to bet dollars to donuts that it's the standard of care, because they don't have, there's no other path. There's no other standard. That's all they have. You know, that they don't have a backup. They don't have an alternative. They have that. And if you come to them, they prescribe you a bunch of crap. And if it doesn't work, they change the prescription or they prescribe you more. And it's our medical industry. Well, it's like they keep this appearance and they keep this facade that they can fix everything, that they know everything, that scientists know everything, that they've figured all the problems out. Humans were extraordinary. You know, we've got everything sorted out. When really the gaps, they don't know. What they don't know could fill the Grand Canyon over 1 trillion times. And it's situations like these that kind of throw it in your face, because they're kind of at a loss. They don't really have much to say. They're just like, well, that's all we have, you know? It's all you have. Does that mean, I mean, it kind of makes you wonder, is this their the knee kick reflex for this too? Like, people come in and they feel sort of obligated to do something, so they just prescribe people a bunch of pills.
That you just, as psychiatrists, they throw the medications at the wall to see what sticks, what helps, and then they switch if
Jesus.
it doesn't help. Now, there are people claiming that what you might have been seeing here is a severe side effect to these drugs, or a neurotoxicity. There's a lot of attention now around the neurotoxicity of psychiatric medication. I know Michaela Peterson has come out and talked about that. She's very interested in this phenomena. I think what you're really talking about then is psychiatric medication taken over a long time, that can cause neurotoxicity. I think that's plausible. But here you have to prove that this was a sudden psychiatric break as a cause of these medications. Prescribed is not the same as ingested. What she says next is very telling.
Doctor, all those drugs that defense counsel just listed, you're aware she wasn't on all of those drugs at the same time, correct?
Correct.
And did you know that many of those drugs she took a very small amount of? Some she didn't take any pills at all?
I was not aware of that.
For Buspar, which is one of the ones he mentioned.
This is not a good look.
Were you aware the first prescription she only took 2 pills out of that bottle?
I was not aware.
Were you aware the second prescription a month or so later for Buspar she took 0 pills out of that bottle?
I was not aware.
So where are you getting this information about what she was on and when?
Yeah, so one of the things that we do is try to collect as much information as we can during our assessments. And so we look through the record in terms of what was.
Yeah, waffle. I mean, playing devil's advocate here, we can really only work with the information that the patient is giving us, right? We are not tarot card readers. We don't do lab tests just to prove if the patient is telling the truth or not. It's really just what the information we can collect, and then you have to make a judgment. So if the patient comes and says, I didn't take those pills, then you have the information. She was only told that the patient didn't take the pills. In the murder trial after, I have some sympathy for the psychiatrist, but all of that sympathy I had was lost when she then repeats the serotonin myth on stand. And this is an Ivy League educated psychiatrist. This is the
Of course
reason
it is.
for psychobabble. She says, basically, I'm paraphrasing here, but depression is caused by low serotonin in the brain. And that has clearly been disproven a long time ago, in fact. That is not something we should still believe, let alone testify in court. It's absolutely ridiculous that she still believes that depression is caused by low serotonin in the brain. So yeah, I had some sympathy here, and then that was lost.
We also talk with other providers as to what they prescribe. But in the context of the assessments that we were doing, it did not require us to determine, what exactly she had been on before, because we were using a different set of medications to treat something, different symptoms that she was experiencing.
Okay. So you really have no idea what she was taking or when? You just know what was prescribed?
I know what was prescribed, and then we were also getting reports of what was being taken, what wasn't being taken. But
from the defendant?
Correct.
Okay.
So the prosecutors were able to prove that Lindsay Clancy hadn't taken a lot of the medication that she was prescribed. And in addition, Justin Brower, he's a forensic toxicologist for NMS Laboratories, he took the witness stand and presented a chemical analysis of the blood drawn from Lindsay Clancy following the incident. He said that the concentrations could not represent a toxic, lethal, or massive overdose that would indicate an acute drug-induced delirium or self-poisoning attempt. He said that it was not consistent with that. So, of course, you can have adverse effects from therapeutic doses. Of course, that can happen. And also, metabolism matters. This was taken after the event. It doesn't settle the insanity question completely, but it does matter if the public story is that a toxic chemical cocktail turned her into a zombie. That is a much stronger claim to be making. And there's just not evidence to support that. The other argument that the anti-psychiatry influencers are pushing now in relation to this is the going postal story, that you can take an SSRI and then immediately commit awful homicides. I've made episodes about the awful side effects of SSRIs and that psychiatry is not practicing informed consent. I'm very critical to psychiatric medication. I'm very clear with the people that I counsel that I don't prescribe psychiatric medication. That being said, this sort of Farmageddon, I mean, look at the numbers. You have today in the Western world, you have roughly 80 to 100 million people taking SSRIs every single day. In the United States alone, 1 out of 6 women is on an antidepressant. So, if this was a drug that could suddenly flip a switch and turn a normal, loving person into like a lethal actor without any warning, we would have a bloodbath in the suburbs in every neighborhood in America. When 80 million people are on a drug, and just a fraction of a percent commit a crime, and then asserting that the pill hijacked their brain, that's not epidemiology. That's like statistical absurdity. To me, when I hear this, it's just they're trying to shoehorn this case into their pre-existing opinions, hunting for these sort of cases to make it fit. Then they're saying that she had akathisia, which is another side effect of psychiatric medication. That's what they're saying that Jordan Peterson has. This is about neurotoxicity. if she had that, what you would expect to find is motor restlessness, a gross disorganization, impulsive behavior. I mean, none of the descriptions we've heard, nothing of what they're reading from Lindsay Clancy's journal suggests that this is what she had. Akathisia is intense inner restlessness. You can't sit still, you're so agitated, you're dysphoric, you're pacing, you're shifting. She built a snowman with the kids, she went to an appointment, she was on phone calls. That's not the behavior of someone who has a neurotoxicity akathisia. And so next up, the defense will call Dr. Resnick, and he is a big macher in the world of postpartum psychosis. That I came across this influencer talking about postpartum psychosis. And this is where I think we have to be careful with bending definitions out of shape to excuse female behavior.
One of the most worrisome signs of postpartum psychosis can actually look falsely reassuring. And unfortunately, it's why so many cases get dismissed without the right treatment. I'm Dr. Katrina Fury, a Yale-trained board-certified reproductive psychiatrist.
Yale-trained people
who join social media
Right.
to correct medical
Had to make sure she
misinformation
got that in
and
there.
spread education and awareness about
No, what she's spreading is advocacy. She's an advocate.
reproductive mental health conditions. Postpartum psychosis has been all over the news lately.
You know, I was just looking at some posts on X. And like, check this one out. Lindsay Clancy and the dark side of modern motherhood. As women recognize their own struggles in Lindsay Clancy's story, that should be disturbing here. I mean, well, it is. We should be asking why motherhood still leaves so many women dangerously unsupported. Should we, though? Should we, though? I mean, really, should we be asking ourselves that question? Because, like, didn't we just spend half a century, like, tripping over ourselves to help women and to make life more bearable for them, give them this, that, and the other, and it's apparently it's not enough. What more could they want? Women are still so dangerously unsupported. Well, which ones are dangerously? I mean, is it okay? So why motherhood still leaves so many so unsupported? Well, women are in charge of motherhood. They pick and choose when they do it. Like, nobody can do it for them. Nobody can do it for them. If a woman wants to have a kid, it's just like if I want to have a kid as a guy, I'm gonna have to make some sacrifices. Like it's gonna be a tough road. I'm gonna have to change the way I live, and I'm gonna a lot of sacrifices. I'm gonna have to I don't even have the means right now. I mean, that's really, and so I can't have kids if I wanted to. I don't have the means. And if these women don't have the means, then don't have the kids. Then don't have the kids. But I'm tired of hearing about how much more help you need. I need help too. Like, I would like to have kids too. But you don't see anybody, oh, men are still so unsupported. How can we help men? How can we reinforce the men? No, man, we've done this for half a century or more. I mean, what more can we do? Honestly, what more can we do? It's just going to take like another 10% of our income? Is that what that's really the only thing they could be talking about? Or, I mean, I don't see how else. Oh, they're still so unsupported. Well, we don't even have male spaces. Women have all these things and they're still so unsupported. Like, what the hell? when I wish, we just need to like have it out. Okay, what is going to be enough? Draw that damn line in the sand, give it to them, and move forward. And then the next time they say, oh, we're still unsupported, they can't get away with it. So, I mean, if you're still so unsupported, or you're unsupported, well, don't go it alone. Or maybe it's just more evidence or more reinforcement that the whole strong independent woman thing doesn't work or isn't the right way to go about it. Because the strong and independent thing, we have that, and at the same time that women are girl bosses and strong and independent, they're also still so unsupported and struggling. Well, are they strong and independent or what? Or what? Because you can't still be so struggling with the unsupported motherhood and strong and independent. Those things, no, they're mutually exclusive. And it's like, I kind of just want to throw my hands up and say, well, screw it then. Yeah, we'll just die. Like no more. It gets so frustrating, man. It's never enough. There's always something else. And, we've been dealing with this. This is normal. But, it's like what's not normal is that they have a lot of power now. There's nobody there to say no. Enough is enough. If they want, they could just totally vote to take our money. Just say, no, we need it. And just take it. And half of me believes that it would have that we just go through with it too. Like America would totally swallow communism if they just couched it or camouflaged it as like women, like helping women. We would swallow that whole quick, fast, and in a hurry.
Because of the Lindsay Clancy trial, I want to be really clear.
Yeah, there's some crazy stuff on here that like women like sticking up for this woman. And it really is kind of crazy. Like, are they like concerned that are they worried that they might strangle their children in the basement? Like they're like trying to as usual, it's beyond, I don't understand it.
That I've never evaluated Lindsay, and nothing I'm about to say is meant to suggest a diagnosis or comment on the treatment she's received. But I've seen a lot of incorrect information floating around on social media. And as a reproductive psychiatrist who treats patients with postpartum psychosis all the time, I want to set the record straight as a real doctor, not an influencer. One big, huge, misunderstood hallmark symptom of postpartum psychosis is a fluctuating mental status. What does that mean? It means symptoms come and go, sometimes rapidly over the course of a day or even hour to hour. A woman can look completely with it, even warm and playing with her children, and then become disorganized or disoriented shortly.
So what are you trying to say, lady? That this is acceptable and that women killing their kids is just something we're going to have to get used to? Is that what she's trying to say here? We're just going to have to get used to our women strangling our kids to death with fitness bands, apparently. That's just the new norm, guys.
After, and then even go back to acting like their normal self.
How convenient. It is the most convenient psychiatric diagnosis ever, and it only happens to women. It's only the postpartum psychosis we're talking about here, not the schizophrenic psychosis, not the drug-induced psychosis. It's only the psychosis that can only happen in women. How convenient. It is so far from reality. The very definition, that's why I defined it in the beginning, the very definition is that you lose touch with reality, that you are disorganized, that you can't process thinking normally. Why should postpartum psychosis be granted this diagnostic pass that the other types of psychosis never would? They
Because
would be
it's for
laughed out of the room.
women. No, it's for women. That's how everything for women works. Don't you know that already, lady? You have a channel devoted to toxic femininity, and you don't understand this yet. It's crazy.
What she's suggesting is that a psychotic person can be completely fine one moment and completely psychotic the next, and then completely fine again. What she's actually referring to here is that something that Dr. Resnick has talked about, where the best way to describe it is an intermittent symptom expression. Partially compensatory mechanism, sort of masking. But the moment you say masking, people immediately jump to, oh yeah, it's women are so great at concealing their emotions because they're so oppressed all the time. So they just get used, they're socially conditioned to not tell anyone how they feel, except we tell people how we feel
Okay.
all the time and really loudly. So this is why this
Exactly.
concept of masking just has me all fired up. So they're claiming that she can socially mask. What they have observed is that mothers who have postpartum depression and then postpartum psychosis, they'll be very anxious about having their kids taken away, and rightly so. They should not be left alone with their kids. And so they can sort of put on a tense smile and sort of say, I'm okay, everything's okay. And then the person will leave, or the nurse comes in and asks, do you want any breakfast? No, I'm fine, I don't need any breakfast. And then the nurse will go and she'll say, oh no, she seemed fine just a moment later. But what they haven't seen is that you can sit down for a whole conversation with a psychiatrist and them not noticing anything. There will always be some evidence of the psychosis there, although it can fluctuate a little bit. But to claim like this doctor, not an influencer, is doing that, can be completely fine one moment and then completely psychotic the next. I have to ask myself if the patients she's diagnosing are really postpartum psychotic patients, or if we might have to call cap on that one. It just seems to me that we want to.
Like, that's pretty scary, bro, that you have a quote unquote Yale trained psychiatrist that we're calling cap on when she's talking about like accountability for when somebody, kills other human beings. Like, that's scary, bro. That's scary. Like, that's not, man, that really lands a blow to our medical industry. Like, bro, that there is that much variability. We are not in good shape, man. We are not in good shape, dude. This woman, I mean, I think she's the more objective one here, but the fact that that other one is saying that, and it's like, and these people, like, bro, this is not good. Like, that's crazy. That woman just said, what, quote unquote, cap. Like, oh, I'm going to have to call cap on that one. Yeah, that's pretty scary considering the fact that she's talking about patients and her practice and mothers of children and like, oh, dude. And that doctor, who, honestly, maybe she's just like, maybe she's, what do they call it? The sister. Maybe she's just representing the sisterhood. Yeah, running cover for, you know what I mean? Like, maybe that's not what she believes as a doctor. Maybe she's just rushing out to do that to get validation from the other women. I mean, she did post it. Obviously, she did it for validation. But like the fact that two doctors are disagreeing like that, bro, that is scary. If two engineers disagreed like that, you'd be scared to go in any building you'd be scared to go into a building. If two engineers were that far apart on structural integrity. Yeah, that would be wild. And this is one of them's a Yale, made sure she mentioned that, right? A Yale schooled doctor. And basically making excuses for, like, 1 minute they're fine, the next minute they're not. It's like, well, what are you trying to tell us? That, that we can't hold people accountable for murder because of this?
Create a unique, unfalsifiable category of psychosis for postpartum cases that would never be accepted in any other psychiatric disorder, where we're talking about letting someone off the hook for criminal behavior. We're talking about someone who became so psychotic that they killed their 3 children. Then you're talking about a florid psychosis, not a prodromal psychosis. You're really talking about going from being completely fine to being so psychotic that you killed 3 children.
That's
We have to
crazy.
keep that in mind when you're talking about masking and fluctuating symptoms. And then now I want to talk about responsibility and female agency here. Let's say she could mask. Let's say that's even possible to mask a psychosis. Or, I doubt it, but okay. Why couldn't she mask in the 20 minutes where she killed her children? Why don't you
Bro,
mask then?
That's what I've been trying to say. Like, bro, how is it that she took care of her own kids, but then, flubs her own suicide, like, in half at, you know what I'm saying? Like, bro, what is going on? Like, I don't believe any of this. This is all a bunch of hocus pocus and horse feathers. I don't believe it, man.
I'm just saying, I don't think this masking argument is the one you really want to go with. Because if you're masking, that is voluntary. That is a voluntary compensatory mechanism.
Yeah, that means she had the ability to say, hey, I'm not, things aren't, I can't be alone with the kids. Yeah, so I don't think that's not a good lane for them to be in, not a good road to go down, because that's the way I see it. It's like, yo, it's, people have self-agency, and it's if something's wrong, it's incumbent upon them. If somebody starts telling you in your head to strangle your kids, I think it's incumbent on you to say something about it. I mean, and then again, they're crazy. It just, there has to be a yardstick for that. Then a lot of this, then those medications can't be prescribed to women. Have to, you know what I mean? The precautions have to be taken. If somebody is just totally unaccountable for their actions for the 9 months after they have a kid, well, then they need to be in a padded cell. All women, if that's the deal, you need to be in a padded cell for 9 months. I mean, this is absurd.
So that means you are tethered to reality, which just definitionally would move you away from the term psychosis. And so Patrick Clancy, he took the stand. It was absolutely devastating. He broke down. They had to turn off the cameras. It was horrifying to watch. He described that in early December, Lindsay had told him about intrusive thoughts,
Maybe we'll
about
watch that.
hurting the children, but more specifically about something medical happening to them. So it was in the realm of having obsessive compulsive thoughts and perfectionist thoughts. And
yeah, well, sounds like maybe he dropped the ball a little bit there. I think that would be, I mean, if my wife said something like that to me, man, dude, it wouldn't just go in one ear and out the other. That's for damn sure. That's for damn sure. I would have followed up on that. Or something. You got to do something. That is a cry for help. That's what that is.
something would happen to the kids, that the kids would get really sick. this is where I want to bring in the term altruistic filicide. That is where the parent thinks that they're doing something moral to kill the children because the kids might be better off dead than alive. And it's very often followed by suicide attempt. The parent thinks, I want to commit suicide, but if I'm going to commit suicide, then the kids have to be dead first, because that would ultimately be better for them. According to what's been testified so far, it seems that Patrick Clancy, having been told, I'm having intrusive thoughts about something happening with the kids, and the friend being told, I'm having dark thoughts following medication change, those are the only hints at the sort of delusion or thoughts around the kids before the event. The command hallucination and the sort of psychosis symptoms were only told in the aftermath. Intrusive thoughts and psychosis, they have two different mechanisms. Like intrusive thoughts, they're ego dystonic. So I'm having this horrible thought. I don't want it. It frightens me. It doesn't belong to me. It doesn't feel like me. I want it away. That is very often then with people who have OCD and are very perfectionist. It's not really me. I want to get rid of it. While psychotic delusion or hallucination, that's usually seen by the patient as a part of them. It's like, what's wrong with everyone else? This is normal. There are two different things, two different pathways. And I would say if you're having intrusive thoughts that are so strong that you worried about.
I kind of want to watch that Patrick Clancy testimony. I want to hear what that dude had to say. Not going to lie.
Well, members of the jury, thank you for your patience with us. What we're now going to do at this point is we're going to return to the evidence. We have witness Patrick Clancy, who testified earlier, is now being recalled, as I said, for the purpose of cross-examination. Okay. All right, counsel.
We've got the moments here where everybody's going to.
Afternoon, Mr. Clancy.
Oh, that seems
You and I
pretty
have certainly met before, correct?
Correct.
Would you agree with me that I went with you and your brothers, and maybe some other people, into your home very shortly after the state police finished with searching and removing what they felt was evidence from the home?
Yes.
And you recall that went into different rooms and looked at different things, and I think I took some photographs and the deliveries that she was in. Can you see that, Mr. Clancy?
Yeah.
Pull it away a little bit. Looking at this, what does it appear to be to you, if you know? Does it appear to be notes of deliveries that she was involved with?
Yeah.
You see the first one? What's the date, if you can read it? I can't.
It says May 11th, 2015.
And does that indicate, would that, to your knowledge, be around when she started working as a labor delivery nurse?
I thought she started a little early, but I'm not sure.
Okay. You see the name of the little girl that was born on that date that was her first delivery?
Yeah.
What's the name?
It's Cora.
And is that the reason you guys named Cora?
It was, yeah.
Can you tell the jurors, as a husband?
Man, that son of a bitch looks worn out. I mean, maybe that's just how he looks, but the guy looks racked. I mean, he looks like he's tired and doesn't look like he's in a good place, to be honest.
Living with Lindsay over the years, what kind of a mother was she?
She was very dedicated. She did everything. She started reading the books at 3 months. And she made up songs for them. I remember she used to make Green Eggs and Ham for Cora because she liked that book.
Is that one of the Dr. Seuss books?
Yeah. She brought them to music classes.
You're quite the musician yourself, isn't that right?
I play a few instruments, yeah.
You play guitar?
Yep.
In your home, one of the things that appears to be striking is that almost every room, other than maybe a bedroom, well, actually a bedroom, but was dedicated to children. Would you agree with that?
Yeah.
Now, you didn't have a fancy dining room, right?
We did not, no.
What did you have in the dining room?
We had the table that I grew up with.
How about stuff on the wall in the different rooms? Did she put things, wall hangings on the walls for the kids?
There was a lot of art projects.
Art projects?
Yeah.
And they were hanging on the wall?
Correct.
Who hung on the wall?
I think Lindsay did.
And would she also take hundreds and hundreds and hundreds of pictures of the kids?
Yeah.
Do you recall her putting together a little collage saying newborn, 1 month, 2 months, 3 months, 4 months, and then hanging that on the wall?
Yeah, she did it for each kid.
And which child was that?
That was Dawson.
Dawson. Did you have occasion to see her interact with Dawson as a...
Ray, did you wish to introduce those photographs?
Okay, appreciate it. Please go ahead.
It's 60 and 61.
Okay, thank you.
Can you describe for the jurors her relationship with Dawson? I know he was a little kid, but I mean, did she, to your observation, did she love Dawson?
She loved Dawson very much.
Did she resent him?
No.
You are familiar with, as her husband, Lindsay's, let's say, use of social media, such as Facebook, right?
Yes.
Can you tell us, would you look at her Facebook a lot and the pictures that she would post?
To be honest, no, not really.
Okay. Were you able to identify any of her postings on Facebook?
Probably.
Okay. Representative, over the years, or the period of time, I'm going to ask if you can identify this particular Facebook.
And if we may approach briefly.
Sure, yeah, Council.
I'm going to approach you, sir, and ask if you can identify this as being an email that you sent.
Yeah.
Put up with that, Your Honor.
The objection.
Addict.
No. Lindsay, I think, wanted to. She definitely didn't want to take any more benzodiazepines, and definitely didn't want to take any more Seroquel. I think that it wasn't really a matter of trying to get off the medication; it was just trying to get on the right medication.
Okay. Let's say mid-December, what observations, if any, heading up towards Christmas, did you guys endure?
She seemed to get worse. The Seroquel was increased to 400 milligrams.
400?
Yeah. And,
By Dr. Joletta?
Yeah. And the idea behind that was it would help with sleep, but she didn't get better. She got worse.
Do you recall that at one point she went to a place called Women's and Infants in Rhode Island?
Right.
Women and Infants Center for Women's Behavioral Health. Do you recall?
You know, I was thinking about this weekend about women, Western women, and you know, like they're a big reason why we even got to where we got as the West. You know, that we have the things we have to some degree. You know, they've raised all of us, you know, Western men, and they were the women that settled the West, that, you know, went along with their men to pioneer a lot of these frontiers throughout the history. And they were tough, and they were feminine and tough. They didn't have to behave like men. They were tough and maintained that femininity. But, you know, I was thinking about it though, like how, you know, they talk about all the social constructs and whatnot about, oh, patriarch is a social construct, race is a social construct, this and that. Well, Western women, that was a social construct. The women, their affect and their behavior was a social construct. And we destroyed it. It's gone. Like that whole, you know, the greatness of Western women is gone. Whatever the past greatness is gone. Maybe they're still great. You know, who am I to judge? But those women, those tough women that went out into, you know, that settled Texas, you know, and took, you know, they pioneered our country. They made it what it is today. Yeah, that's like totally gone, you know, and now what, you know, we have something different, you know, they basically, they destroyed the Western woman of the past. It's like whatever we have now, we're gonna have to make do with it, figure out or I mean, because that's we're not getting that back. Like that kind of stuff, like once it's gone, you're not getting it back. Same thing with a lot of cultural stuff too, like stuff that has nothing to do with women. Once it's gone, it's not coming back. Those standards or those social mores, yeah, they're we can't get them back. I mean, it would be damn near impossible, I would imagine. But like, and there there's so much different today, and like this stuff here, it kind of goes, it feeds right into it. That they've changed quite a bit, and it's like because really the way men behave is a social construct to a certain degree. I mean, there are certain instincts we have, but there's personality and stuff or behavior. That's all learned stuff. But women and men without those things, like I'm not so sure that that men actually, like if it's women, like the physical, their body, or if it is the social construct of females in the West. You get what I'm saying here, and I'm not so sure. Like the way women are today, there's nothing that says men find women attractive no matter how they act. And what I'm trying to say is, maybe we're just not, or men just won't like women very much going forward. Like this is a possibility. Women and men, like I said, we both have these social are things that are considered masculine or things that are considered beta. Like those are all things that people have sort of learned, or they're just things that we have come up with as time goes on. Those aren't they're like, if we were more like animals, that wouldn't be our behavior. If we were closer to wilderness, if we were closer to a state of nature, our behavior wouldn't be like it is now. And same thing with women. What I'm saying is women and the way they are is not set in stone. Women physically, their body, their breasts, their figure, all that stuff, that is what it is. That's genetic, and that doesn't change. But behavior wise, habits and affects, ways of carrying yourself, those things change. And you hear a lot of times that men don't love women, they love the idea of women. They love the idea of women. And I hear people say it all the time that men have they have rose colored glasses for women, or they have an idea of women in their head that isn't real. That's not reality. And I just was thinking about this and thinking, there's no guarantee that men will find women attractive. Because it's very recently they changed, and men haven't found this iteration of women attractive yet. You know what I'm saying? Like that's what I'm trying to say. And there's no guarantee that they ever will. And like that's a real problem. And I'm maybe I'm wrong, or maybe it's bad to ask that question, but I think it's an honest question, and just curiosity, because we're in uncharted territory here, and there's nothing set in stone, or there's nothing about women other than their physical appearance, that men are nothing that men are obligated to like or to or to find attractive. Now, their physical being and their physical, like, men are going to find that attractive. But there's nothing that says, there's no place, there's no book where it says men have to find women attractive, have to enjoy being around women. You get what I'm saying here? And I'm not so sure that, like, I'm not so sure that they do actually find them attractive. And also I was thinking, like, what if could we not conceivably have a social order or a social system like elephants, where men just, they kind of congregate with themselves, and the women congregate, they run in a herd, and the two only meet when there's reproductive needs. Like, I was shooting this by my AI, and it was like disagreeing with me on most of it, but it kept bringing up spurious stuff that had nothing to do with what I was talking about. But, like, is it not conceivable? Because there's quite obviously a rift between men and women at the moment. And it seems like men just can't get right. We can't do anything right. And it's just, I don't know. I was thinking, like, that is an option. They say, oh, women, they seem to think that they do it best when it comes to everything. Maybe that would be a better arrangement. Right? I mean, kind of a matrix. I mean, it's kind of like that already as it is, and I get the feeling that we don't have a whole lot of control over this train. It's just, or the car, and it's, who the hell knows where it's going to go from here. But something that doesn't give me very good, it doesn't give me sense of security, is the people that are telling us how it is. Like, and this is why I'm not so sure. Like, I could see the elephant thing happening, but, like, the people that are telling us this stuff, they don't seem all that intelligent. They really don't. And let's not forget that these are feminized industries. These are feminized. Most of the people telling us this, I don't know if they're women or not, but, they've been getting a steadily declining a standard of education. And I don't really believe anything they say anymore, because they're not really objective anymore. I don't see it. And I don't think they really care about objectivity anymore, if you want to know my opinion on it. And so, honestly, I think we should be ready for curveballs and stuff, because, I think they don't know their elbow from their ass. Like, all the people at the top of these institutions, doctors and this and that, sociologists, it's all very hard. Like, they don't have any real fact-based evidence. They kind of just look at the numbers and sort of make, or, draw conclusions, form hypotheses. And they're wrong all the time. They figure it out all the time. So, I just don't have a whole lot of faith in them, in these institutions. But, I mean, I could see it just getting to that point where, I mean, we're literally, we're already there practically, where women raise all children and men really don't have much input on it, to be honest. And, I mean, maybe that's best. Shit. You know, and I think that would be the consequence, or that would be the result of women in the amount of power, political power they have, and the fact that they do everything in lockstep. That's why we're going to keep losing our asses here, because most men don't even vote. All women vote. So it's like, bro, we're being led around by the nose, man. Who are we kidding here? I'm not sure men even really care. But I mean, would surprise me, and it would not surprise me to watch society lean harder and harder and harder to one side until it is. I mean, we already practically live in two realities, two different societies, two different internets. Would it be so hard to believe, that that we institutionalize that? Make that like the rule or something. I was just thinking about it, and just kind of it occurred to me that, I don't think like and the people that are in charge, or the people that are telling us about it, they don't have the foggiest notion what they're talking about. And I just think, like, I think we're going to end up with some place that we didn't expect to end up. That's my intuition anyway. That's what I intuit.
Right.
Right.
Do you remember when she actually went to Women's Behavioral Health?
Sometime in mid-December. I don't know the exact date.
All right. So if I suggest to you, sir, that I have certified copies of the women and infants medical records indicating that on December 20th of 2022, that was the day that you dropped her off at Women. Does that refresh your memory?
Yeah.
Your Honor, I'd like to offer the certified copies of the women and infants hospital records.
We would object. We don't have a copy of those.
All right.
You don't have them?
Can I see everybody here?
And it's like doubly bad that she was like a nurse, and then like still worse that she was a delivery nurse. Like, that's so creepy. And it doesn't look good. It doesn't make women look good. And really what I was getting at with what I was just talking about women is like, if they continue to say we're struggling or we still don't have the support, doesn't that lend credence to the way, like, for the way we used to have it? Isn't that evident? Like, if women are just continuously saying we need help, isn't that just like evidence that, hey, yeah, you shouldn't be trying to do this alone? Yeah, you need, like, you know what I'm saying though? The more help, and it's, you see them, they're constantly alluding to how they need more support and stuff, and it's like, well, what kind of support? Like a husband, a father for the children? Is that the kind of support you're lacking?
And where did you go skiing?
Wachusett.
At some point in the afternoon, did you receive a phone call?
Yeah.
Was it from Lindsay?
Yeah.
And as a result of the phone call, what did you do?
She said that you need to come pick me up, and the doctors here want to talk to you, have you come in and talk for a bit.
Okay. Did you go and talk to them?
Yeah.
Do you remember who you talked to?
I don't remember their names.
Do you remember the conversation? Did you describe or indicate what her symptoms were at that point in December 20th of 2022?
Yeah, the conversation was, they didn't...
Objection?
Yes.
All right. Sustained at this time.
Did the people at Women's and Infants facility in Rhode Island prescribe any medication to your knowledge?
I don't think so.
They provide any counseling or anything?
I think they tried to, but they felt that it wasn't the right fit for Lindsay.
Okay. Do Do you recall that, in fact, it was because of the drugs? They weren't sure what symptomology would be because of the drugs?
Objection.
Sustained.
Do you recall whether or not the people at Women and Infants in Rhode Island reached out to Dr. July?
Objection.
I don't think so.
If he knows.
I don't think they did, no.
And was it one day or half a day that she went to Women and Infants in Rhode Island?
It was a half a day.
Half a day. So after you pick her up and you bring her home, it's now you and the kids and Lindsay, and it's days before Christmas, right?
Yeah, and her parents were there.
Why were her parents there?
They were visiting, trying to help out, and I took Dawson to watch Cheez It, so they stayed home with Cora and Kellen.
Now, during that time frame, December of 22, maybe a little bit before, maybe after Thanksgiving, did your mom and dad and Lindsay's parents come to your house and try to help out with the kids?
Yeah, I think it was separately, though.
Yeah, of course it would be separate. I mean, what would they do?
Just be there, help out, play with them, get takeout, play Scrabble.
Did Lindsay's mother and father actually stay there and sleep in the basement for?
They did, yeah.
Time? Were you aware personally? Let me back up. You and Lindsay, as husband and wife, would in effect sleep in the same bedroom. Is that correct?
Yeah.
There was an occasion, though, that she said to you about you go downstairs, and then I think she ended up downstairs.
Yeah, for the purposes of her getting better sleep.
And for her purposes of getting better sleep, were you aware that on one occasion she used a gummy, a sleep aid gummy? Did you know that?
I don't recall that, but we did have them in the house.
Okay. Now, to your knowledge, was Lindsay a person that liked to smoke the weed and use the CBD
I'm sure
oils?
they have sleep aid gummies that don't have weed in them. I'm sure. Everything, you can get anything in a gummy nowadays.
And all that stuff, or did she not imbibe in that?
No, she didn't smoke.
So you had these gummies in the house, sleep aid, right?
I mean, some people might call them a sleep aid.
Okay. Heading into the holidays of 22, do you recall where you spent Christmas?
I think it was at our house. We celebrated Cora's birthday. And then I think we actually went down to Wallingford, Connecticut to be with her parents after.
Her parents?
Yeah.
Okay. And then heading into January of 23, who did she then see for doctors or nurse practitioners, if you know?
After she got back from McLean?
Yes.
She switched back to Jennifer Tufts.
Now, before she switches back to Tufts in January, on New Year's of 2022...
Foggy for the last couple of years, but...
I understand.
Yeah.
Okay. In January, as time went by, do you recall that she would actually continue to take notes of her medications that she was taking, right?
That sounds like something Lindsay would do.
Kept a diary or a little log, right?
Yep.
I'm approaching you, sir, with this and asking if you can identify this. Anyway.
Yes.
And when you say yes, and I put it on the little screen, what is it?
There are no clips.
It's the dosage of medication that she took and how she's feeling.
So this is kind of like a little medical diary that she was keeping?
Yeah.
For example, here you see on that 5 milligrams Valium, 200 Seroquel, slept well, horrible thoughts in the morning, right?
Yeah.
And did she at some point, I think...
What's up, guys? Welcome to my...
Yes.
That may be a
Pearl
minute.
did one. Nice.
Thank you.
This is what I
What's up, guys? Welcome to my reaction series. So today we are reacting to the Lindsay Clancy
Wow,
case.
that was
Basically,
like-
this woman...
I was literally on like 1.25 speed too, and it still seemed like they were going slow. What the hell? It was crazy. Court, man, piss on that turd.
killed her kids. And, the nurturing gender is protecting women. So here we go. Before we start, guys, I'm doing private dinners in New York City and Dallas in the next 2 months. One is in September, one's in October. I'm literally just flying to New York City. I'm probably going to do some sort of podcast debate.
January 24th of 2023. She was charged with 3 counts of first-degree murder and other related offenses and pled not guilty. She's currently on trial to figure out what her mental state was at the time she committed this. Here's everything you need to know about this case. In 2022, Patrick and Lindsay Clancy had 2 young children, Cora and Dawson. And in May of that year, Lindsay gave birth to their 3rd child, Callan. Following the birth of Callan, Lindsay began experiencing significant mental health difficulties, and she sought treatment from a number.
Postpartum depression is post-nut clarity for women. So what happens is when women
What are
have
you talking about, you dumb? What an idiot! No, what? That's the dumbest thing I've ever heard.
as many kids as we want to have, we realize, have you guys ever wanted to hook up with a girl and you really thought you liked her and then you had sex and you realize you didn't? The problem is for women that doesn't happen till after kids.
Her postpartum psychiatric illness, despite all the medical consultations she underwent and psychiatric treatments, which included medication changes. The defense even provided a list of dates and all of the medications that she tried and the changes.
Yeah, but if she's a manipulative woman, she probably thought that through, that she could use this as a get out of jail free card.
She underwent to try and stop what was happening. They said she was experiencing insomnia, anxiety, depression, intrusive thoughts, suicidal ideation, dissociation, and other psychiatric concerns. On the evening of January 24th, 2023, Lindsay asked her husband Patrick to run out to pick up takeout food and medicine. While he was gone, she took the lives of their 3 young children and then tried to take her own life. CBS News has made up a timeline based on all the evidence that was provided in court. At around 5:15 that night, Lindsay sends Patrick to pick up the takeout food. Just moments later, she texts him and asks him to also stop and pick up Pedialyte. Patrick testified in court that it took him about 3 minutes to get to the CVS, and you can see him on surveillance camera at that time. At 5:33 p.m., he calls Lindsay to tell her that the CVS didn't have the medication that she wanted, and she doesn't answer. However, she shortly calls him back and told him that the generic brand of this medicine was fine. In court, he was asked about Lindsay's demeanor during that phone call, and he said that she was quiet, that he thought that she seemed busy, and he remembered thinking that maybe she was giving the kids a bath because she seemed preoccupied. At about 6 minutes before 6 p.m., Patrick leaves the CVS and then begins his drive to the restaurant. He testified that it takes about 10 minutes to get there. After he picks up the takeout food, it took him about 10 minutes to return home. And he said once he arrived home, he started calling out for Lindsay and the kids, but no one was answering. This was about 10 minutes after 6. He said he was calling their names around the home, even yelled down to the basement, and there was no answer. And that's when he called Lindsay's cell phone. Eventually, Patrick went upstairs and found their master bedroom door locked, and he said this is when he knew something was wrong. He said he finally got the door open, saw the window in their bedroom was open on the 2nd story, and then he ran outside and found Lindsay on the ground. She had jumped out the window. There had been blood throughout the room of their master bedroom, and when he found Lindsay on the ground outside, he asked what happened, and she told him she had tried to take her own life. When he asked where the kids were, he said in the basement, and that is when he called 911 and went to the basement to find his children. This is a transcript of the 911 call that was played in the courtroom. It starts out with Patrick telling the dispatcher, "My wife tried to commit suicide." Then he says to Lindsay, "Stay awake, stay awake." He says she jumped out the window. Then he says a short while after that, "Where are the kids, Lindsay?" The dispatcher at this point tells him not to move her, and he says to her, look at me, open your eyes. It's not really bleeding, it's just an open wound. Did you fall out the window, Linz? Did you fall? Is there something on your neck, Lindsay?" And a little while after that, he says to the dispatcher, "I need you guys down here now. She killed the kids." When the first responders arrived at the Clancy household, they found a severely injured Lindsay outside on the ground, and the couple's 3 children, Cora, Dawson, and Callan, were all unresponsive in their basement. Cora was 5 years old, Dawson was 3, and baby Callan was just 8 months old. It's alleged that all 3 children were strangled with these exercise bands in the family home, and the 2 oldest died on scene, but baby Callan survived for several days and then succumbed to his injuries. It's being reported that Lindsay had ingested medication, injured herself, and then jumped from the second-story window. Now, she's...
No man could kill all of his children and then have women come to defend her or give him the benefit of the doubt.
But she did suffer a catastrophic...
That could never happen. That, bro, I would believe that God came down and parted the Atlantic Ocean before I would believe that women jumped in caping for men or for a man that killed his kids. I mean, it would take an act of God for that to happen. If it would even happen then, who knows?
Catastrophic spinal injury that has left her paralyzed from the waist down and in a wheelchair. According to court filings, Lindsay and others have now filed lawsuits against medical providers for not providing the care that was needed to prevent the situation from happening. This case is in front of the courts right now, and the defense is not arguing whether the children died or whether Lindsay was responsible for this. What they are arguing is that her severe postpartum issues are what caused her to do this, and prosecution is fighting that. The defense is presenting several reasons why Lindsay's postpartum psychiatric illness is responsible for what happened. One of those is the fact that she had repeatedly sought medical treatment from the moment that Callan was born. According to the filings by the defense and the lawsuits that the Clancys have filed, blunting, and according...
Because they even said, yeah, that usually happens. Like, this was 8 months down the road. It's just, they usually get it within the first 3 weeks, and even then the symptoms that they have she wasn't exhibiting.
To some allegations, all
kids, jail for life. That's it. I don't really care why you did it. I really don't.
That escalated after
if it's true with your mental illness, I don't want you mentally ill out in society. Like, you're still mentally ill.
If you went and drowned 3 kids, your children, you don't get to be in regular society anymore. You don't. Like, and why should we have to live with somebody like that amongst us? I don't want to bump into this person. I don't want to, no. That's not only that, that person has to be sequestered from society. Can they ever be trusted not to murder somebody else? I think we owe it to each other to have a society that keeps us safe from people like this.
You need to be locked up forever.
The birth of her child. They're saying she suffered from postpartum psychosis, which is a rare but severe psychiatric condition associated with childbirth. They're saying that this contends that this condition impaired her ability to appreciate reality and the wrongfulness of her actions at the time of the incident. Whether the evidence supports that diagnosis is one of the major questions being presented right now.
Hey, they want to pursue that argument, but I think that is just going to burn them. I don't think that's going to be a good idea for her as a defense.
Now in court. They're also saying that she was on so much medication that they were overlapping, and some of them may have caused a bipolar spectrum, saying that so the burden on the defense is not to prove responsible, and they have enough
kids out with you. Girl saying to the
of
strangling her 3 children to death.
See this girl saying to she wants to prove her husband.
The jury was taken today on a grim tour of the house.
Sorry, I can't hang out. I'm busy listening to the Lindsay Clancy trial so I can prove her husband did it.
This is what I started with, where I said millions of women in America are saying the husband did it. Everybody in the courtroom, Lindsay, the state, the defense, the husband, everybody says she did it. And yet, white women all over the country say he did it.
Her kids are postpartum. You can never make me hate Lindsay Clancy. You are never going to make me hate Lindsay Clancy.
Didn't she strangle all 3 of her small children by hand? This toxic allegiance to women and thinking that women can do no wrong or perpetrate any type of abusive.
Right? She strangles her 3 kids by hand. Well, there must have been something that allowed her to do that, because women are perfect, don't you know? It's hilarious, honestly. That's what I was saying to start with, is how men would never get this benefit of the doubt. If a guy strangled his 3 kids, people would just say, "Oh, this guy was a psychopath and he was hiding his psychopathy." A woman does it, "Oh, she was on medication, postpartum, this, that, and the third." Did it ever occur to you that she's just insane? Or that she's just a psychopath, an evil person? Is that not a possibility? Am I at a line here? Is that not a possibility? Could she just not be an evil woman that wanted to kill her 3 children with her bare hand, or with a fitness band? And why is it like, how is that not whatever? It's not what everybody's talking about. Instead, everybody's talking about every other possibility. When we used to think that evil people did evil shit. It wasn't, they're sick, they're this, they're that. No, they're wackadoos. They're sick, or they're evil. Not even sick, they're evil.
Problematic behavior is sick as fuck. I'm not here to debate whether you think she's right or wrong. This whole morally superior, you can never make me hate her shit, hang that shit up. That is not girlhood. I don't know what crackhead told you that. Yeah, we're not doing this about Casey Anthony, and you sure as shit wasn't doing it about Gypsy Rose. This
Right?
girl's girl bullshit. It's like it only applies when it's convenient for y'all. Right, like accountability only applies when it fits your fucking narrative. But then, this is what gets me. Y'all call women pick-me's for only wanting to be around men. When I told my husband how women treat each other, he didn't believe me until I showed him on TikTok, until he saw it play out in my own life.
Yeah, that's the thing. Women, there is nobody that is meaner and more brutal than women, if we're being real honest. So, anyways, guys, I love you. Thanks for watching.
Yeah,
Like the video, subscribe to the channel, and I'll see you next time.
They have a nice cover, they have their reputation to cover them up, but really, we're kind of seeing that the reputation is not even close. Like, it's just like, women are not, they're not fairies, they're not angels. Certainly far from it. It's as far from it as we are, at the very least. It's all so tiresome. It really is. And with the women, it's like, no matter what we say, we're wrong. I mean, unless we agree with them, we're wrong. As far as they're concerned, I don't know. It's crazy. Yeah, I think I'm gonna cut the stream short tonight. I just wish I just wasn't a very good night for me. I don't want to make excuses. It just wasn't a good day today. Anyways, hope you guys enjoyed the show for what it's worth. I know it wasn't my best, so anyway, like and subscribe if you haven't already. I'll see you guys tomorrow night.